How accurate is a diagnosis via telehealth? Imagine sitting in your living room, talking to a doctor on your computer or phone, and getting a diagnosis that guides your next steps. It might sound simple, but how reliable is that diagnosis? That's what we're here to find out. When it comes to telehealth, the accuracy of diagnosis depends on many factors. Studies show that in most cases, diagnoses made through video visits match what a doctor would find during an in-person exam about 87% of the time. That means most remote diagnoses are pretty close to what you'd get face-to-face. Telehealth works really well for certain types of conditions, especially mental health issues. For example, diagnoses in psychiatry through telehealth have shown agreement rates as high as 96%. This is because mental health assessments mainly relying on talking and observing behavior, which can be done effectively over video. But for other specialties like ear, nose, and throat or skin conditions, the match rate drops a bit. These areas often need physical exams or specialized tools that patients usually don't have at home. For instance, a doctor might need an otoscope to look into your ear or a dermatoscope to examine a skin lesion closely. Without these tools, the diagnosis might not be as precise. The main challenge in telehealth diagnosis is the inability to perform thorough physical exams or tests that requiring special equipment. This can sometimes lead to missed details or the need for follow-up in-person visits. Despite this, telehealth is still very useful for initial assessments, follow-up care, managing chronic illnesses, and mental health support. It's especially helpful for people who live far from clinics or have trouble traveling. Young people should know that while telehealth can diagnose many health issues accurately, some symptoms or conditions may need an in-person visit for confirmation. If a healthcare provider feels a physical exam or specific tests are necessary, they will recommend coming into the clinic. Telehealth can save time, reduce travel, and provide quick advice, but it's not a complete replacement for all medical exams. As technology improves and remote diagnostic tools become more common, the accuracy of telehealth diagnoses is expected to get even better. Devices like home blood pressure monitors, pulse oximeters, and even digital stethoscopes are making remote assessments more reliable. So, for many health concerns, telehealth is becoming a safe and effective way to get quality care.